Right, first of all, I hope that you had a good dinner last night, and those of you who were at the morning breakfast sessions, you get double points, so we were very impressed. We have a really interesting day today, so I'll tell you a few things about it, and then we've got a slight change of plan for one of the sessions. So first of all, welcome back. Day 2 of NHS Providers, the annual conference, and the theme, of course, this year is Vital. I want to just remind those of you who weren't here yesterday that we are encouraging conversation on X, formerly known as Twitter, and on LinkedIn. You can use the hashtag NHSP23, and you can tag us at NHS Providers. To make the sessions as interactive as possible, we'll be taking questions from the audience. In fact, our first session, we're actually going to be asking you to give questions that you'd like us to be passing on to the new Secretary of State. So you start thinking about those. We'll have roving mics in the auditorium, so you can raise your hands and someone will come over to you with it. And you can also submit your questions via Shake It, whether you're in the room or you're outside. And you scan the QR code with your phones or tablets, select the session that you're in, or you can follow the website address on the screen and go to Ask a Question. And please provide your name, your job title, and your organisation when you submit your questions so we can identify you if you wish. And we are live streaming the plenary session, so those of you who are joining us remotely, you can participate in the Q&A as well. We have a photographer on site. All plenary sessions are being recorded and live streamed to Shake It and around the conference venue, and we may use photographs and footage on our website and the social media channels. There are no fire alarm tests today, so if you hear the fire alarm and a verbal announcement, which will be made via the PA system, please follow all the instructions from the stewards and make your way to the nearest exits. A reminder as well to turn your mobile phones onto silent, please, during the sessions. So, great day lined up. Many of you may have woken up to the news that came from NHS England and Amanda Pritchard, who's one of our keynote speakers today, about plans to eliminate cervical cancer. We'll also be hearing from Wes Streeting, the Shadow Secretary of State for Health and Social Care. And we will be having a contribution from the new Secretary of State for Health and Social Care. And this afternoon, we're also planning a discussion on what the public should expect from the future NHS. But what we're doing right now is, because obviously she's just in post, the new Secretary of State, the Right Honourable Victoria Atkins MP, is going to be making a kind of pre-recorded speech, but we have a panel, and the idea of the panel is that they're going to respond to what she said and raise their own concerns and questions for the agenda that she should be setting for herself. So can I welcome all my panellists to the stage, first of all, for this? We have Nick Carver, Chair of the Nottingham University Hospitals NHS Trust, Therese Patton, Chief Executive of the Bradford District Care NHS Foundation Trust, Daniel Elkeles, the Chief Executive of the London Ambulance Service NHS Trust, and Saffron Cordery, Deputy Chief Executive of NHS Providers. Thank you all for agreeing to be in this panel at quite short notice. So what we're going to do now is we're going to have a short pre-recorded filmed speech from the new Secretary of State following her appointment, which of course was on Monday, and then we're going to discuss what her immediate priorities should be. So let's have a listen to the speech.
Hello everyone. I want to start by thanking you all for all the fantastic and vital work that you do. I'm sorry I can't be with you in Liverpool, but I'm really looking forward to getting to know you and working with you in the weeks and months ahead. It's a genuine pleasure and a privilege to be your Health and Social Care Secretary. My belief in our National Health Service and its founding principles is one of the reasons I came into politics. Now, I know you might hear this a lot, but for me, it is truly personal. Like families up and down the country, I owe our NHS a lot. It has cared for me and my family and brought my wonderful son into the world. And I want to make sure that it's here in fighting fit form for our children and our grandchildren, just as it's been here for us. We have got a lot of work to do as we continue to bed in the reforms government brought forward last year to create strong and integrated care systems across England. This will be a shared endeavour, and it will require all of us to work in partnership across our acute hospitals, mental health, community, general practice and pharmacy. as we reduce the pressures that I know you're facing, we give patients the best possible care and deliver the urgent and emergency care recovery plan for winter. We know winter will be challenging, but this year we have all started to prepare earlier than ever before. And using our recovery plan, we can continue to expand capacity, build resilience, and deliver better care. This has to be our #1 priority. And I recognise that this requires working collaboratively with other organisations and sectors. For example, working with the police to support people suffering from mental health crises. And I'm also very conscious that I'm not just the Secretary of State for the NHS, I'm also the Secretary of State for social care. Our unpaid carers and social care workers look after millions of people every single day, and I cannot wait to work with them too. Now, we'll face challenges along the way, but believe me, I'm an optimist. Together we can overcome these challenges and take the long-term decisions that will build a brighter future for our NHS. And this is the approach I will take to industrial action. I am acutely aware of how the strikes have disrupted patient care, and I'm committed to getting around the table because I want to see a fair and reasonable resolution. This winter will be challenging, but I know that rising to such challenges is what you will do so well. You've overcome a once-in-a-generation pandemic. You've tackled the longest waits for care that it left behind, and you're delivering reforms that will give patients more choice and control over their care. We've got clear recovery plans in place, financial certainty for the rest of the year, and the first ever fully funded, reform-focused, long-term workforce plan, something that I know NHS providers have been a strong champion for. Now, I started this speech by thanking you. I mean it sincerely to you and all of the incredible people who work in our NHS and social care services. So let's roll up our sleeves and get on with the job. Now is the time to deliver for patients and deliver for our NHS.
So the new Secretary of State, I mean, a couple of things I noticed you might talk about when you've made your observations is I was interested to hear her claim of there being financial certainty and a fully funded long-term workforce plan. But interesting as well, references to getting around the table in terms of industrial action and seeking a fair and reasonable resolution, which seems to me a change of policy. But let's hear what all your thoughts are and your hopes for what the new Secretary of State could be doing. Let's start with Nick Carver.
So I think we were asked what we would want to show the Secretary of State. So I recognise the Secretary of State's got a really tough brief. It's not a great inheritance that she's been handed. So I'm going to offer to take her for a walk in the autumn sunshine in beautiful parkland.
Before we go any further, can I just ask if you could get the clock going just to help our speakers? Sorry, I'm not obsessed with time. Sorry.
Right, yeah, absolutely. I'll try and do better. But I'm going to take the Secretary of State for a walk in beautiful parkland, hopefully in the autumn sunshine, in an area just outside Loughborough. We're going to walk through land donated to the nation by the Duke of Westminster. As we do so, we may want to talk about his vision of responsible capitalism and what that looks like, and his belief that as a nation we can still do things really well when we put our minds to it. As we walk through this parkland, we're going to look ahead to a building that's spectacular in the distance, the Defence Rehabilitation Centre, that built a few years ago. And then we're going to turn off left and see a fantastic building coming out of the ground, the first ever National Health Service Rehabilitation Centre, a spectacular building. We're not there just for the views, but we will reflect upon the wise words of Julian, I think, a couple of days ago, when he said that most of our buildings, or many of our buildings, relate to the 1830s. I'll say that we have many like that. But we'll reflect upon the fact that this fantastic building in this setting sends two messages. Firstly, to our patients, that they're important, that society values them. And secondly, to our staff, that actually they can still dream big and still aim to create excellent world-class services. And then we'll perhaps turn to the numbers, because I know that the Secretary of State is very strong on numbers. She looks at facts. She's built a career upon looking at facts. And so we'll note that in this country, 35% of people post-major trauma are rehabilitated back to work within 6 months. In defence, it's 80%, but the population there is somewhat different. But in Europe, it's 50 to 60%. And so somebody far more clever than me will have worked out the numbers, what that means in the East Midlands, and what that could mean across the country in terms of this investment securing the ability of people to get back to work. If the Secretary of State says, that's very nice, Nick, but I'd like something more gritty, we'll go to the A&E department at Queen's Medical Centre, and we'll reflect upon the fantastic work done by staff there in the most difficult of circumstances. We'll reflect upon how we've improved efficiency to take out the equivalent of 50 beds in the last 6 months. But we'll also perhaps reflect that today there are 25 people awaiting discharge to the streets. 25 homeless people awaiting discharge to the streets. At this stage, I'll introduce her to our Chief Executive, Anthony May, who understands this world far better than I do, and he'll ask that she resource local authorities with housing responsibility to have adequate provision for vulnerable people and to deploy expert resource in hospitals. Finally, my last ask of the Secretary of State, and it's a challenging one for us as well, and it's been a current running through this conference, is that she should recognise that encouraging great people to be leaders in the NHS is not something that is nice to do. It's existentially critical to the National Health Service. She may be able to reflect that organisations fail if their leaders are not appropriately prepared for or prematurely exposed to the challenges they face. And it's the same in the health service. This is too vital to reduce to a culture war, and I don't think, in fairness, she'll do so. And then finally, a bit that perhaps is less popular in this audience, but I'm going to ask the Secretary of State to do what Secretary of States really like doing. I'm going to ask her to performance manage us as species NHS leaders, and to performance manage us on the way in which we better value, develop, and manage our talent. She may want to start off by asking Sir Gordon and Dame Linda how we're doing against their wise recommendations.
Fantastic. Thank you so much, Nick. Therese Patton.
Thank you. So, first question is, where would I ask the Secretary of State to come? I would bring her to Linfield Mount, which is one of our inpatient hospitals in Bradford City Centre. And Julian talked a bit about this yesterday. It was planned and built in the 1950s when we had a different expectation of what mental health was. I think people were locked away. They were put in a place where they couldn't be seen. So thoughts of therapeutic recovery and support and enablement and daylight and living a good and full and happy life is not what you would see if you look at the building we have in Linfield Mount. It is really struggling in terms of sight lines. It is crucifix shape. It regularly, I'm talking about weekly, has sewage come through the floor. We have shared bathroom facilities, and mental health patients can stay in facilities for 3 months, for 4 months, for years. And that's not the environment that we want our people to be in, because we know from evidence that actually if you support people to be well, they can live really fulfilled and happy and safe lives. But I'm not just taking her there to see the building. I want to take her to see the staff that we have working inside that building. So I'm talking about Bradford. I have every type of staff member in that building, from doctors to nurses to therapists to psychologists, to the people who clear up the sewage weekly, our estates teams. And not only do we have that real diversity of roles and experience, we have a diversity in terms of colour, in terms of sexuality, in terms of the food people eat, in terms of the religion that people follow. And what we see in Linfield Mount, which is a very difficult and challenging environment, is that they are united by their difference, and because of their difference, they are stronger in the care that they bring to those people. So what I would say, and I see some of my colleagues here, what I say always, and I'd like the Health Secretary here, is health and care is a team game. It's a team game. There's not one individual that makes an impact on one patient or service user. It's about all of us doing the best we can. And if we are as diverse as we possibly can be, then we know that we do better together. So if that's the micro level, I go to the question that I'm asking the Health Secretary to think about in terms of the macro level. And it's similar, really, because if you look at our building where we've got sewage coming through the floors, I think in terms of the NHS and social care, there could be some similarities. So the situation can be seen difficult, but actually, again, it's a team game. And I look around this room, and I've been here for the last day, and I see years and years of experience and knowledge in this room, millennia probably from some of the people who've been here for as long as I have. And actually what I ask the Health Secretary to do is to trust us to actually take this really precious thing that is the health service and the care service and actually move it forward. So a bit of air cover, a bit of support. It's about the climate that you bring to enable the leaders, as Nick said, to enable the leaders of the health and care service to be the best that they can be.
Fantastic, Therese. Thank you so much. Daniel.
Okay, so when you ask people to describe the NHS, I think they're most likely to tell you about their GP and an ambulance. So what I'd want to show you, Secretary of State, is the ambulance sector, and what I'd like to set as a priority is how you'd create more capacity in primary care with the specific purpose of improving care for older people. So the real workings of the ambulance sector is one of the NHS's best-kept secrets. The scale and reach is immense. In London, our 999 and 111 teams answer the phone 13,000 times a day, see 3,000 people face-to-face every day, deliver more babies in a year than the hospital I was chief exec of, and we are the largest provider of crisis mental health in the capital. And for 2/3 of people who phone us with a critical emergency, we will have dispatched a response within 45 seconds of the phone connecting. But what I would also be keen for you to see in the ambulance sector is what Julian saw when he came on a visit, about how we're creating a very different culture. I believe very strongly that when people can bring their real self to work, which means they feel safe, they will deliver the best patient care, and then you will get a lot of discretionary effort in return. So for our sector, that means aspiring to move from a command and control, insular, white, male-dominated, to one where staff are empowered, they work in teams, we nurture and grow all our talent, we look like the people we care for, and we focus on staff well-being. So yes, that means we have a big focus on equality, diversity, and inclusion. Yes, that does take some money and some experts, but mostly it takes a lot of thought and leadership commitment. And what it means is we have reduced our turnover, reduced our sickness rates, and we have more hours on the road as a result, and a massive pipeline of people who want to come and work for us. But away from the stats, I just want to give you a real example of why this is so important. So last weekend in London, it was very tense, and a lot of our team were nervous about what they might experience. So we asked our new Jewish and new Muslim staff networks if they could author a joint message to go to all our staff. And they did better than that, because the two chairs of the networks came and delivered it live on our weekly Q&A show. Their statement began in Hebrew, began in Arabic. It spoke of how both their faiths embody the trust values of caring, teamwork, and respect, how they condemn discrimination of any kind, and how our duty is to care for everyone in London and every member of Team LAS. The feedback from nearly the whole organisation was palpable, and I can't imagine that happening a couple of years ago. And it's why I'd want to show you, Secretary of State, the importance of creating a culture where everyone can flourish. So then on the top priority to fix, so there are lots, whether it's industrial action, funding, capital, workforce, social care, but I would make improving care for elder people a top priority. And it picks up on what Chris Whitty wrote about last week. And it doesn't just mean we need an answer to social care, because we can all see lots of examples where we aren't getting it right for older people in the NHS now. Huge long waits in A&E, lots of avoidable admissions, people dying in hospital when they didn't want to. And this means we're wasting a lot of our funding, squandering our ability to be productive, and parochially on the ambulance sector makes our response times worse. So creating a fit-for-purpose older person's NHS should be in our gift. It should make the most of the ICS architecture we have created by encouraging us not to work in our organisational silos, but together in the interest of our patients. We heard yesterday about work in Coventry to join up many provider teams to reduce emergency admissions. And in my previous role, when I ran a hospital, we did something very similar and saw a sustained reduction in elderly care admissions every year for 3 years in a row. And in the ambulance sector, our calls are disproportionately from old people. So in London, we are blending the paramedic and the urgent community response services together in many boroughs, and as a result, conveying far fewer people to hospital. But there's so much more we could do. Imagine if all our older citizens had a well-worked-up multidisciplinary care plan and the support package to keep them healthy at home. To do that, we need to shift our resources into community-facing services, and we need to create the capacity in primary care so they have the time to do it. Well, we're not going to create a new workforce in primary care quickly, but we can rethink how all the rest of us support primary care. So, for example, in the ambulance and 111 sector, we have huge capability with our workforce, telephony, and triage abilities. And we're right in the early foothills of exploring how we can use this to support different ways of delivering same-day urgent access to primary care. And if we did that, we'd free up GP time to spend on care planning for old people. And that would reduce the emergency burden on our hospitals, and then we could spend more time focusing on elective recovery. So I think improving the care for older people that they receive in the NHS today is doable, the public would notice, our staff would be engaged, and our current resources would go a lot further than they're currently able to do.
Daniel, that was terrific. Thank you. Saffron.
Thank you. So I'm going to focus a bit on the priorities for the Secretary of State, really from a national perspective. And of course, the thing that we have been calling for on your behalf and will continue to call for until it's resolved is to see the industrial action behind us, because we know what an impact that has had on staff, on patients, on the ability to see people in a timely fashion, to really get through those very long waiting lists. And I don't just mean in acute trusts or hospitals, I mean across all services who've been feeling the impact of that, and that means mental health, community and ambulance services as well. So we really need to see that industrial action behind us, and I was very heartened to hear Victoria's approach there in the film, which really focused on coming to the table, negotiating, having a conversation and listening. So that feels so important, and I think there's even more reason for hope than there has been over the last few weeks, where we know that talks have been underway. So resolving industrial action, absolutely critical, particularly critical for our workforce. The second thing I think is critical for the Secretary of State to focus on is productivity. And I don't mean this from the perspective of hammering all trusts on productivity and saying you have to be more efficient. It's actually to invest in productivity, because we know that that lack of investment is the thing that has really undermined productivity. So we've got to think about all of the things we've heard about investment in capital, which actually paves the way for more productive services. We've got to think about that protection in investment in wider services, including social care. We know that if you're investing in the health service but you're not investing in social care, then you aren't going to get the services that you need, because of all the challenges that that creates. And I think it's particularly around thinking about how we invest in wider local authority services. And you mentioned that, Nick. I think that is fundamental. We've seen councils hollowed out over the last decade. We absolutely need to see that investment to bring about the productivity that we need. And then my final point, because I'm really aware of that clock ticking away, that final point actually is for the Secretary of State to really be brave enough to take a long-term view at a time when we've got a very short-term political agenda. So I would like to see her pave the way for a more preventative approach. We had a great panel yesterday focusing very much on prevention and in all of the elements that that needs. But without the national political support for prevention, that's not going to go anywhere. And without prevention, we're storing up many problems in the future. So those would be my three priorities.
Fantastic. And just to remind you that we'd very much like this session to be about you coming up with your own questions that you'd like the new Secretary of State to be considering. But I wanted to just to follow up with your panel with some of the issues that you've raised and that are kind of implicit. So the new Secretary of State comes from a Treasury background, and some of you have implied that in your comments. And I just wonder, there was that news story the other day about the gap between the £1 billion that NHS providers said was needed to deal with the kind of long-term impact of strikes, and the tenth of that the government committed to. I wonder what your thoughts are on how far we can expect to see a reappraisal of financial need and how far that is actually at the heart of it. I don't know who wants to go first. Daniel, do you want to?
So I think we don't really yet know what the consequence of all that money that hasn't come from the Treasury but has come from NHSE and the DH is. And I suspect we're going to rue quite a lot of the decisions that have been made about where that money has come from. because I suspect some of it will be from backlog maintenance that now won't happen. Some of it won't be from technology investment that won't happen, or at least won't happen this year. And that will all be bad news for our ability to be productive going forward.
Okay. Yeah, go ahead, Therese.
Yeah, so it's difficult, isn't it? I think we've got what we've got, actually. And I've had this conversation in my own organisation. We might wish for more, but actually we've got what we've got. We have to do the best we can with it. So we are doing a lot of work in our organisation and in our place to actually make sure we're using the pounds that we have to absolutely the best effect. And I think if we do that well and we can demonstrate that, then that will be recognised and supported. But I think we can't always wish for something that's not coming. And I know that the team in NHS England have tried really hard to get the best deal that they can for us, and we are grateful for that. And what we can do is do the best with what we've got and not wish for things that actually aren't within our gift.
Nick and Saffron, did you have anything to add?
Well, I find it very difficult to comment upon its adequacy. It's almost an unanswerable question, but I agree. We've got what we've got. I think the point that's been made by Saffron earlier is right there. We have so many inefficiencies in our systems. You know, I remember a Prime Minister, but 2 or 3, I think, saying, we will sort social care once and for all, bish, bash, bosh. And it's not quite sorted, really. And that creates so many inefficiencies in our systems. We need to look at efficiency in a wider way, really.
Fine. Saffron.
I mean, this is, it is a really challenging question. I think what we have to take comfort from is that the new Secretary of State does come from the Treasury. So if nothing else, we can hope that she's got the Chancellor's ear to make a really good case on behalf of the health service. And I think that would be a nice, encouraging, fresh approach.
Excellent. We've got time to start taking your questions that you'd ideally like to put to the Secretary of State, if you've got them. We've got microphones in the audience. If you want to wave your arm around, and we'll try and spot you. Can't see one at the moment. There's one other thing I wanted to raise, which was former Secretary of State Steve Barclay had implied that he didn't necessarily want to see a dedicated inclusion role in the new integrated care boards. And I know that various NHS organisational bodies had pushed back against that. It seems to be fundamental to the issue of workforce morale and, clearing the backlog. It depends on staff feeling that they're listened to and that leadership is representative. I wonder what your thoughts are on that, and whether that might be something that will change, should change. Do you want to go first, Saffron?
Yeah, well, I really hope it does change. And I think there's such an important point here, which is about recognising the very important role that those roles do play across the NHS. We're not talking about kind of nice to haves here. We're talking about the direct link between inclusive working cultures and patient safety. So, there is research that proves that is the case. And beyond that, it's something that every organisation owes to its staff to give them a safe working environment, and those roles are integral to that. So I think that, it's absolutely critical that we reverse that sense of hostility that has arisen around those roles. And I think that, the Messenger review had inclusivity at its heart. So if we could see that rolled out, that's work that's already done, waiting to go. And we know that elements of it are there being rolled out in a different way, but it would be great to embrace that.
Thank you. Therese, did you have thoughts?
I think we look around the NHS and we see that we're not representative. Yeah. And I'm not just talking about colour, I'm talking about disability, I'm talking about sexuality, I'm talking about everything that makes our society exciting and diverse. And actually, until we are representative, there's a job to do. So I have a pretty fantastic tiny EDI team in our organisation who really punch above their weight. And if we have to invest money, I'm absolutely committed. It's the right place to invest it.
Daniel?
Oh, well, in violent agreement here. So we've just created an EDI team in London Ambulance Service. It's paid for itself already. Yeah. There's a massive moral dimension to all of this about people being able to feel safe at work, but there's a huge economic benefit as well. I am totally sure my organisation is performing better because people feel safer at work. So we have more staff on the road caring for patients as a result. I think that is very positive.
Thank you. Nick?
One of the nice things about being a non-executive director is it doesn't really matter if somebody sacks me, really, so I can perhaps be a bit more direct here. So I'm really encouraged by media reports that the Secretary of State took a stand, actually, in government and criticised behaviours and languages that would be unacceptable in our organisation. So I'm encouraged by what I hear about her. I think it was really disappointing that the last Secretary of State suggested this wasn't important. Of course, we don't want to build bureaucracies, but actually this is fundamentally important, that those who manage the National Health Service should reflect the people we are here to serve. So I think the mood music has already changed, actually, and from the little I know about her, I'm very, very encouraged that it will continue to change.
Fantastic. We've got some comments that have come in already as questions for the new Secretary of State. I'll read one of them and then see if we've got ones in the room. This is from Professor Richard Scothan, Chairman of the County Durham and Darlington NHS Foundation Trust, Cuton Community. What can you do, Secretary of State, to help me encourage school pupils from poor and also diverse backgrounds to reach high and train as our future doctors, nurses, HCAs and vital staff? We've got questions in the auditorium. Yes, there's one over here. And if there's another one, stick your hand up and we'll get another microphone to you. There we go, thank you. Do tell us who you are, if that's okay.
Hello, I'm Rebecca Hainsworth. I'm a senior associate at Brown Jacobson. So I just wanted to, I suppose the question for the Secretary of State is that she spoke about strong integrated care systems. And I just would like to know what she would see her role as being in supporting integrated care systems and provider collaboratives as they start to really bed in with the new legislation that we have.
Thank you. I don't know if anyone wanted to comment on that, but thank you for that question. Yes, we've got one down here near the front, middle of the row. White collar, black jacket. Thank you.
I'm Kath Lavery, I chair Rotherham, Doncaster and South Humber Foundation Trust. In all honesty, we've only got about 6 months, haven't we, before we go into general election mode, assuming that they don't go in May, that they're heading into October. So just a panel view, really, on what they really wanted to do in the next 6 months, because that sort of brings an end to it for me, with a new government, of either flavour, whether they win or they lose, but a new government. So, you know, really, honestly, in 6 months, what do you want it to achieve?
I mean, a general election might not happen until January 2025. So
they'll
taking your viewpoint...
They'll go before that.
Yeah.
Go on.
I mean, I don't know what the panel's experience has been of going into general elections and what impact it's had on discussions with previous secretaries of state around issues. I know it's a predator thing, but Saffron, what are your thoughts?
Yeah, I think that there is... I think this speaks to the point I made earlier, which is there is so much short-termism. Once we're kind of in almost decision paralysis on many issues because you're in the run-up to a general election, and that makes it incredibly difficult. And then it's kind of short-termism and then knee-jerkism as well, because some issues will then require a big kind of political statement, response, decision, policy that you wouldn't possibly have thought anyone would entertain in a non-election period. So I think it's that unpredictability which gets really challenging. And also, you just know that the politicians aren't making those decisions for the long term. So even what might be committed in spending reviews, you know, is going to be revisited. So it's that sense of the pure electoral cycle really impacting on decision makings and on planning. And we know from a health service perspective that the ability to plan with the security of the funding behind it is the one thing that can be transformative, because a massive industry with a huge number of staff actually needs to be planning over 5, 10, 15 years, not 6 months or 12 months or 3 years.
Yeah, a couple more comments that have come in online. How will the Secretary of State envisage supporting a focus on the future through a focus in children and young people, so we can support young people to thrive and live meaningful, healthy lives as adults? And another one about the future. Most successful companies look to the future, not the past, and concentrate on efficiency and effectiveness. Is it time for the NHS to explain to the public what the future needs to look like for the NHS to deliver better solutions and quality within the available resources, workforce-wise and financial? more questions in the room if we have them. Otherwise, there's lots coming in online, but do wave your arm around. If I'm not seeing you, someone will spot you. So a couple more that I've got here. As was done during COVID, do you feel the private sector should play a greater part to help clear the 7.8 million people on waiting lists? Secondly, I fear that there may be more BAME and other minorities not included in the above numbers. How do we reach them? In fact, that's something I might ask what people's thoughts are here about waiting lists, and indeed the implicit suggestion there that perhaps there's an underreporting in them too. I don't know if you want to take that first, Therese. Is that fair to ask you?
Just thinking about mental health, and we've talked a little bit about children and young people. We've got a real problem of waiting for particularly neurodiversity. And actually, if you're a young child and you're waiting for 2-3 years for a diagnosis, then it's really difficult. And I suppose my ask to the Secretary of State is, yes, have a focus on that and maybe resource it, but actually we can't solve that problem because it's so enormous. We have to think about different ways of doing things. We had a really interesting session yesterday talking about inequalities and how we might look at them with a really different lens. So some of the work we're doing in Bradford, for example, is rather than waiting for a diagnostic assessment, we're trying to make Bradford a neurodiverse friendly city, so you don't need the diagnosis to get access to resources and support. Actually, you have the resources and support anyway. So I think, yes, we need a focus, because if you focus on things, I think our ICB chief exec says if you focus on things, actually you make things happen. I think we have to focus on it, but we also have to think really very differently about how we might address some of these long-standing situations and problems.
Any other comments in closing about either that issue, backlogs, or more generally thinking with the Secretary of State's inbox?
So I think
Saffron.
On that specific issue on health inequalities and people who may not be already scooped up by current waiting lists, I think there is something really important about looking at waiting lists through a health inequalities lens. And we know that NHS England in its core 20+5 work has actually made some really big strides, and trusts have been working incredibly hard to do that. And I think through that process, and engaging with communities and really understanding what's going on, we will probably unearth more people who need treatment. And that is, that's going to be a reality. But I think that the health inequalities lens through which we view things is absolutely critical in terms of making sure that, there is equity in how we treat people.
Daniel, did you?
So waiting lists clearly a bit different in the ambulance sector, so it's more minutes and hours.
Yeah.
But the thing that we worry about every day is the frail elder person who has fallen at home, who isn't a very high priority, and waits a very long time. And that's why I think we have to completely rethink our NHS offer to older people, because that is really bad. The last thing I want to see is a headline in London in the winter of someone who's waited a very long time for an ambulance because we didn't have one. That's wrong. That's why I would like us to get really very focused on how do we get a better care model for old people.
Thank you. And Nick, anything finally from you?
I viscerally believe in the health service and the fact that we provide care to everybody regardless of their ability to pay. But actually we will lose the confidence of the people unless we tackle waiting lists. So I think the priority on waiting lists is absolutely right. My personal view is that I think the private sector with capacity does have a role to play in that. And I say that as somebody who's had cataract surgery. Yes, I really am that old. Cataract surgery through a private provider contracted to the NHS. They have a role to play, but it's really important we continue to make progress.
Thank you. I'll read one more comment that's come in, which seems pertinent to something that's going on out there. Will the Secretary of State commit to responding to the outcome of the COVID inquiry with the same spirit of learning and openness which we encourage in our organisations, and challenge any blame culture as distinct from accountability? Thank you for all those suggested questions. Thank you all to my panel.